And India has added a single-day rise of 7,830 new COVID-19 infections, the highest in over 200 days. In fact, these cases were somewhat on these lines around September last year, over 7,000 fresh COVID cases. This is a sharp jump just if you look at the last 24 hours. What's the situation in Maharashtra? There's over 1,000 cases, 1,150 new cases in the state. In Maharashtra today, the deaths, there have been 9 deaths reported in 24 hours. The active cases in Maharashtra also on the rise. The positivity rate across India on the rise, particularly in Delhi as well as Maharashtra as well. We are taking these two being among the biggest metros and the national capital, of course. I'm being joined by Dr. Ishwar Gilada, who is a consultant in HIV and infectious diseases, and the Secretary General for Organized Medicine, as well as I'm being joined by Dr. Rajiv Jayadevan, who's the Vice Chairman for Research Cell IMA of the Kerala State. Thank you, both of you, for joining us. Well, let me go to you, Dr. Rajiv Jayadevan, first. Kerala, again, among the states which is recording the highest daily cases. My question really being, this is highly infectious. There are more admissions in the hospital, but the message being that there is no panic as such, because this seems to be getting cured easily with less ICU admissions.
That's true. We regularly monitor the trends of the pandemic, and we've been doing that ever since the pandemic started. And what you said is absolutely correct. There are several people who are testing positive, but very few are turning severe enough to warrant a hospital-based care. But we must also remember that when a large number of people get infected in the community, there will be people among them who are frail to start with, who have underlying medical conditions, such as a little bit of heart failure or kidney impairment, liver disease, poorly controlled diabetes. When these individuals get COVID-19, even though it appears mild for someone who is younger and healthier, these people could destabilize, and that could lead to more hospitalizations. Already we are seeing a trend of increasing hospitalizations. But as you said, unlike the Delta wave that ravaged India in 2021, we are not seeing the COVID pneumonias that used to occur in 2021. So that is a good side of it. But the downside of it is extremely fast spreading, and the precaution level in the community has come down. People are not wearing masks, even in hospitals. So people are having to be reminded to please wear your mask inside hospitals. We know that hospital is a place where the most frail individuals are there, and we have the responsibility not to make them any sicker than they already are. So I think with mask wearing improves in the community, at least in the indoor settings, regardless of the age group, I think that will be a positive step.
Dr. Ishwar Gilada, important point being made by Dr. Rajiv, and that's about masks. Now, frankly speaking, I'm in an office where some of us wear masks, some of us don't. That's really what the situation across India is. Perhaps in this office, there might be a little more people who would be wearing masks than you would see what would be happening outside. But having said that, is it time to mask up? Or is it well past that time already?
Yeah. Thank you for having me on this show. And at least we have 2 people from 2 states which are highly
That's right.
highly reported. Maharashtra and Kerala. But these are the 2 honest states which report honestly. Most of the states do not report correctly. Secondly, question about masks. This is not time for mandating masks. It's a time for requesting masks. Masks for those people who have minimal symptom, maybe running nose or even cough once. And particularly for those people who are having comorbidities, above 60 population, and people who are working, who are children, they go back and forth to the community at home. They should be very particular of having infection being brought from community to the family. So those people who have aged people at home, comorbid people at their home, either they should use mask, or those people which are working outside, they come and use mask. Otherwise, mask is required in crowded places, in buses, in trains, in aeroplanes, in hospitals. Otherwise, mask mandate is not required. People are tired of any kind of mandating now of either mask or panic. Nobody will get into any panic mode also. Secondly, this being a XBB variant, which is a sub-variant of Omicron. And for last 16 months, we have not seen a new variant. So if we don't have a new variant, it is not going to be very serious at all. It is going to be infecting people, but hospitalizations are less as proportional to number of cases, and even deaths are less than proportion of cases. If you check week on week, there has been 76% rise between last week and this week, but deaths are only 43% rise. Last week the death rate was only 29%, whereas the number of cases were 58% high. So I think people should not get panicked. I am glad that Government of India also conceded to our request that it is not a serious situation. You can be having preparedness, you can do mock drill, but major problem will come is the vaccines are not available. So what is happening that we become blinded to one side and we talk only on one side. Then we say that use mask, use vaccine. There are vaccines, and
Right.
there has been a criminal waste of vaccine. More than 10 or 11 crore vaccines were destroyed by 2 different companies, and we had no forward planning. Now today, vaccine is required, vaccine is not available easily.
Dr. Rajiv, vaccines not available. Is that, are there a lot of reports coming in that they want vaccines and they are not getting it? How is the situation there? But my also question being, see, in a family, you're having people now getting fever. They're getting cough, but they're not really isolating. And many saying it's not practical now because everyone seems to have a little bit of cough, little bit of fever, coming and going, you know, just a very regular day thing. And then suddenly some person seems to have a longer spell of fever and then they go and check. So in this case, is it RT-PCR or is it a regular test that would do? What are the protocols to be followed?
Okay, I'll take you to that to the early part of the question. That is, if somebody in the family gets a little bit of fever and cough, until middle of March, it used to be a mixed bag. That is, it used to be called a viral fever. Some people had influenza, and COVID was minimally present before the middle of March. But after March 15th onwards, for the next 2 weeks, COVID took over. And now, since April, almost all of these instances are due to COVID. And you asked what tests can be done. We have antigen tests, which are the rapid test kits, which are good when used in the right setting, in the right person, using the right technique. So they are cheap.
Dr. Rajiv, when you're talking about this, how many hours since you develop symptoms, the first symptoms, how soon or how late should you use the antigen tests?
Yes, the antigen tests, it's a very good question. Antigen tests are able to detect the most quantity of virus. So in other words, the test is more likely to be positive when you're shedding the most amount of virus or when you're most infective to other people. So the earlier in the course that you do it, the better it is. Perhaps not on the day 1 of symptoms, but you could do it on day 2 of symptoms or whenever you suspect that you have a problem. Typically, people do not do it on day 1 unless they have been exposed and they are suspecting that they went for a meeting or they went for a wedding and everybody is testing positive. Yes, in that situation, yes. But I must also add that antigen test may show up negative. That's called a false negative, in which case you might require to test for the subsequent days, and that is to overcome the false negative status. RT-PCR is the other test. It's more accurate, it's more expensive, and it's not so readily available as the antigen test is. But on the ground, I'll tell you the reluctance. When you ask doctors about their experience with testing, they'll tell you only about 3 out of 10 patients are even willing to undergo the COVID test. And one patient, in fact, said something rather amusing, slightly alarming. He said, so the doctor asked him, why would you not test? He said, doctor, if I test positive, then I have to isolate. So you see the flip side. So this person is not planning to isolate. He's planning to go around the community and spread the virus. So people should be educated that they should not be spreading the virus. A simple message will be, if you have fever, stay home.